Good afternoon. Can you hear in the back? Is the mic picking up? So I'm Mike Stitely. This is my friend and colleague, Dr. Janet Downs, and we're going to talk about abortion care around the world. And I asked a few questions of some doctor colleagues in and outside of my department about what they actually know about the law and the provision of abortion services in New Zealand or anywhere for that matter. And this is a topic that just doesn't usually come up in other fields of medicine outside of abortion care providers, and sometimes it comes up within the specialty of O&G. But we thought that we can share a little bit about what we've learned, how abortion services are provided around the world, and give some insight. Since this was topical with the election, it seems to be discussed more in political forums than within the specialty of medicine. And this is provision of medical services. So the objectives, so we intend to review the provision of abortion care around the world, including how laws and funding models affect access to safe abortion services, and how and where abortion care is provided. So we're going to frame the talk around this map. And this is an interactive web map of abortion laws around the world from the Center for Reproductive Rights. And this is a very good resource. And the color coding is red is where abortion is highly restricted. Green is where abortion is generally legal. And the orange and yellow colors are areas where it is restricted but available under certain circumstances. And we're going to talk about some comparisons and contrast across national borders that affect the safety and the provision of abortion care. So that's the map I just told you about. So first off, some statistics about how many of these procedures are performed. So from the time frame of 2010 to 2014, worldwide, there were 56 million abortions performed. And the worldwide ratio is about 35 abortions per 1,000 women in the reproductive ages of 15 to 44. And here's a breakdown of what those abortion rates per 1,000 women of reproductive age and the total number of abortions. And the things to note is the total number has gone up, but the rate is going down. And if you look in the developing world, the rate is going down significantly, whereas in developing countries, it's gone down, but not quite so much. And if you look at these nations here, where laws tend to be restrictive, they're going up. Latin America and the Caribbean, 40 to 44. In places where the laws are less restrictive, these rates are going down. So you would think that restricting abortion would make it less commonly performed, but that is not the case. So it's actually counterintuitive. The places that restrict access to abortion also tend to restrict or not provide contraceptive services or other women's health care services. So that is why you see in places that have strong regulations against abortion, they tend to have high rates of abortion. And the difference is not that they're not happening, they're still happening, but they're happening in an unsafe manner. So do restrictive laws reduce abortion rates? The answer to that is no. I think that's the key point of this talk, actually, is that all the regulation does not reduce abortion, it just makes it unsafe. So here's the rates where abortion is available on request, 34 out of 1,000 of reproductive age women, and where abortion is prohibited altogether or only to save a woman's life, 37 per 1,000. So this abortion still occurs, it just doesn't occur in safe manners. So complications from unsafe abortion put a huge burden on women. People die. It costs healthcare systems millions of dollars. So nearly 7 million women were treated for complications related to an unsafe abortion in the world, about $230 million US dollars of cost. And per 1,000 women, 6.9 complications were treated from unsafe abortion. And the other key point of this is that 40% of the women experiencing complications actually receive treatment. Many of them are fearful because of the laws of being prosecuted to present for care if they've had a complication. Up to 44,000 women a year die as a result of unsafe abortion. So talking about some of the laws in the Americas. So South America is a largely red and orange country, or a continent. Contrast along the border, Brazil and Paraguay, strictly prohibited. Abortion services are strictly prohibited. Now again, it doesn't mean they're not accessible, and we'll talk about that in a bit. Now Uruguay recently has liberalized their abortion laws. Argentina for the preservation of health only. Chile has no provision for any legal abortion, regardless, for sexual assault, for lethal fetal anomaly, for the risk of life to the mother. So Paraguay, abortion is only legal to save the life of the woman, but it's still estimated. Look at that number, 145 abortions per 1,000 pregnancies. So it's still occurring. It's just occurring in an unsafe manner. Brazil, abortion is illegal with exceptions for age, rape to save the woman's life, or lack of capacity to care for a child. This is a newspaper article out of the Washington Post. You may remember this recently, where an 11-year-old rape victim in Paraguay was denied access to abortion care and was forced to deliver the child. She was 10 years old when she was raped and became pregnant. So these are the people that get harmed by these types of laws. And in Brazil, there's an article talking about how access, the clinics are quite upscale. So if you are of financial means, you can have access to abortion care. So it's really health inequity between those who can and cannot afford abortion services, even where it's illegal. If you have the money, you can get a safe abortion. So upscale clinics or pills that are obtained illicitly. So who knows what's in those pills and if they're pure. And, but you can obtain abortion pills in many of these countries where abortion is strictly illegal. So in Uruguay, in 2012, they legalized abortion. And the reason they did this was because of the burden of unsafe abortion in their country. So they took a minimization of harm approach and legalized abortion up to 12 weeks. And after 12 weeks is only legal for maternal health risk, rape, or fetal anomalies. And what they found is that abortion is now much safer. And these are also countries where Zika virus is fairly prevalent, and a lot of fetal anomalies related to Zika virus in countries where presenting for care for abortion services is illegal. So Argentina only allows abortion in cases of rape, but they estimate that there were about 500,000 abortions occur yearly in Argentina. Despite that, the way their criminal code is written is that in order to be prosecuted for performing a procedure, the person performing the procedure actually has to be witnessed in the act of performing the procedure. So it makes it very difficult to enforce this law. So abortions are fairly readily available, but still illegal in Argentina. So we took this as a case-based approach as to what would happen to a woman who lived in these places and had an unintended pregnancy. So a 22-year-old unmarried woman with an unintended pregnancy at 7 weeks gestation, and she wishes to have an abortion. So what would happen to her? In Brazil, this is illegal, but the care would still be available in one of the upscale clinics. So for $4,500 US, she could have a surgical abortion at one of the clinics. Or on the black market, she could obtain abortion medications, misoprostol, for about $70. And again, care is more available and it's safer for those who can afford it. And for those who are wealthy enough, they can even travel out of the country to obtain care. But if you're poor, that is not an option to you. So in Uruguay, abortion is legal up to 12 weeks. A woman would spend about $400 to have a manual vacuum aspiration abortion, which is the standard first trimester procedure, which is safe. And the care is reasonably available in standard medical facilities. In Argentina, again, only to preserve health or in cases of rape, $2,300 US dollars for a clinic procedure that would be illegal. many abortions in Argentina occur in clandestine circumstances that are very much unsafe. So North America. The USA is still green, but highly regulated on a state-by-state basis. I'll talk about some of the legislation that is coming through to further restrict abortion care there. So Mexico is an interesting country where the legality differs state by state, but it's mostly illegal except for rape, threat to life, or fetal impairment. They still have about 38 abortions per 1,000 women, which is a little bit above the world's average. Now, what's interesting is in Mexico City, the Federal District of Mexico City, abortion is legal, but the rest of the country it is not. And it's legal up to 12 weeks gestation. So women in Mexico, if they have the financial means to travel to Mexico City, have access to abortion care. But many of the poor who live significant distances do not have access to this care. So they seek illegal, unsafe abortion. So in the US, the laws vary very much by state, and they vary from week to week. It's really hard to keep track of what's legal and not legal in the US and what's been held up by courts. And so it's increasingly being restricted by what are known as TRAP laws, which are targeted regulation of abortion providers. I'll talk about this in the next slide. And there's a question as to how this will shift. We're living in the post-Donald Trump era, and he's now appointed his first Supreme Court justice. So how is the abortion issue going to be seen in the United States when abortion cases start to come before in front of the Supreme Court of the U.S.? It'll be interesting to see what happens, but I suspect that there will probably be more federal regulation coming down from the Supreme Court in their interpretations. So the TRAP. So these laws are intended to restrict access to abortion, and it's done under the guise of safety. They disguise their intent about making abortion safe, but abortion is already safe. So the safest medical procedures that exist. Childbirth in many of these states, maternal mortality in the states that are enacting these laws is rising. And some of the states in the US have third world levels of maternal mortality. Yet they're not regulating childbirth, they're regulating abortion, which is already safe. So this makes me question, well, it doesn't make me question, I know their motives. So just, why do they care about the safety of women seeking abortion services? And all these laws are about safety, safety, safety. It's already safe. And what they're doing when they regulate it, they make it unsafe. So some of the TRAP law examples, forcing women to have a transvaginal ultrasound when it is not clinically indicated in order to have an abortion. Forcing women to look at the images of an ultrasound if they do not wish to. Mandatory waiting periods. Heartbeat laws, meaning that you can't have an abortion after the fetus has a heartbeat detectable. Scripted counseling laws, where the state tells you what to tell women, and these scripts are oftentimes inaccurate, or sometimes just outright lies. Fetal pain provisions, where you're setting a gestational age where they determine that the fetus feels pain and a woman cannot have an abortion after that time. And one of the newer ones, and this is very clever, this was in Kansas, a state that is completely bankrupt and is falling apart all over the place. But they're worried about abortion. So they're so worried about the safety of abortion that they require an abortion provider to give a standard formatted CV, which is regulated down to the font size and the font type, to a woman several days before she has an abortion. As far as I know, Kansas has a state medical board that checks on the credentials. So I guess what that's saying is that they don't trust their state medical board to be able to decide if a doctor is fit to practice. So they require the doctors to give their CVs to the patient before they have a procedure. And they don't do this for other procedures. I think that if you're having cardiac surgery in Kansas, you might want to know that, since they don't seem to have they don't seem to have any confidence in their medical board to regulate the profession. But they're doing this for abortion providers only. So in Canada, in 1988, I won't read the whole statement here, but by forcing a woman to carry a pregnancy by criminal law, they felt was a violation of the security of her person. And with that decision coming down from the court, this legalized abortion in all circumstances in Canada. So what would happen to somebody who lives in these countries? So Ella, a 41-year-old married woman who has 3 children, has an unintended pregnancy, and she wishes to have an abortion. So in the USA, currently, this would be legal in all states. Now, there are some TRAP laws and bans that have been put in place that have been held up by the court until they work their way through all the legal challenges. But currently, this care would be fairly readily available. It is state by state regulated. Cost is usually somewhere between $350 to $500. So this care is available. She may have to go through many, many hoops to receive the care, but the care is still available. In Mexico, this would be permissible in Mexico City, but it would be illegal, and she would have to travel to Mexico City or have an illegal abortion. Cost is around $200 to $300. She could purchase misoprostol and do a self-administered medical abortion for about $150. And about a third of women who undergo an illegal abortion have a complication. So in Canada, access to abortion care is provided under the National Health Care Program. It's a covered service if you are eligible for Canadian health care. If you're not eligible, it will cost her about $400, but this care would still be available to her in Canada. So with the way the US is going, I think Canada is considering building a wall. So I'm going to turn this over to Janet to discuss the abortion laws in Europe.
Okay, sounds okay. So what we see in Europe here is the same sort of pattern, and it's a pattern you'll see right throughout the world, that primarily the global north, the developed countries, are shown on these maps in green with more liberal laws, with obviously some exceptions we're going to talk about, and the global south, developing countries, have more restricted laws. And yet, as Mike said, those countries with the more liberal laws also have lower abortion rates. The rate in Germany is about 7 per thousand, Switzerland 6, Netherlands 9 per thousand, which is dramatically lower than the global rate, about mid-30s. Our rate here is about 14, it's dropped to about 14. So 14 to 20 is quite common in the US, UK, Australia here, people we normally compare ourselves to. But you look at places with very liberal access, Germany, Switzerland and so on, have half our rate. So as Mike said, restricting access doesn't, liberalising laws and making access available does not open the floodgates. There are exceptions. Of the 5 countries where abortion is absolutely illegal, no matter what, 2 of them are in Europe. One is, not surprisingly, the Holy See, which the Vatican City. Now, there's not too many women probably needing abortions in the Vatican City. So, but the other one, and this is probably quite relevant because lots of medical students from here go there and they're totally unaware of this, is Malta. So abortion is totally unavailable if the woman's life is in danger in Malta. What we're looking at the exceptions here, Ireland clearly in red, the UK pale yellow, reasonable, good access there really, and Poland, Ireland, Poland, and also Northern Ireland. But even in the countries with very liberal access, talking about Germany and so on, what the blue numbers will tell you there is the number of weeks that open access is available until, and it's totally arbitrary. In Portugal, it's 10 weeks. In France is 14 weeks, Germany 14 weeks, 12 weeks in Italy, Austria 16 weeks. I mean, there's no medical evidence that's based on, it's just an arbitrary limit at which point abortion is readily available on request. Beyond that, in certain circumstances, Mike's already talked about. But even in some of those liberal countries, Germany, the woman has to have mandatory counselling with the aim of dissuading her from having an abortion. In Holland, where abortion is available to 24 weeks, she also has to have a 5 to 6 day waiting, cooling off period from consultation to procedure. And all that's ever been shown to do is not change women's minds, but actually delay procedures. And you can imagine if you're getting up into the 20 weeks, that's quite significant. So lots of things happen. If we're looking at the UK is interesting because one country, England, Scotland, Wales, Northern Ireland, most countries in the old empire system, the Commonwealth, base our laws, New Zealand does, on the English law. 1861 Offences Against the Persons Act, abortion was criminalised, made illegal. That changed 40 years ago. They're just having celebrations in the UK now. Abortion was legalised under certain circumstances, two certifying consultants, as in New Zealand, certain circumstances, but also taking into account not just mental and physical health, but social circumstances for the woman. And so that was 40 years ago. And that applied to England, Scotland, and Wales, but was never extended to include Northern Ireland. It's the one time when the Ulster Unionists and Sinn Féin have agreed they do not want a liberal abortion law in Northern Ireland. So if you're a woman in Northern Ireland and you're pregnant, you can have an abortion legally if your life is in danger and you're less than 9 weeks pregnant and is funded. If for any other reason you have to either travel or to the other parts of the UK or access online abortion pills through the internet. But if that, say a woman born in Belfast moves to study in Manchester in England and she finds herself in a position to need an abortion in the first trimester, she'll go to a clinic, she'll be provided with a service, she's UK national, she'll get it on the NHS for free. If she is going to university at Queen's in Belfast and she finds herself in the same position and she decides that for her own reasons that she doesn't want to continue the pregnancy, she cannot access an abortion in Ireland, Northern Ireland. She has to travel to the UK, where she has to pay around about the equivalent of about 2,000 New Zealand dollars. Same country, same citizenship, depends on where she's actually resident as to what happens. And people who have access to online abortion pills in Northern Ireland have been punished and prosecuted and punished and fined and with the threat of imprisonment. So the UK has a liberal law except for Northern Ireland. Now that's looking at changing. Dear old Theresa May, under pressure, has actually agreed that maybe they won't have to pay if they come to England, but not that it's making it any more available in Northern Ireland. And Nicola Sturgeon, she said, they can come to Scotland, we'll do them for free for them. So it does matter who your Premier is. And the UK, just last week, the RCOG came out in support of a move towards decriminalisation of abortion. While it's in the Crimes Act, there's still that huge part of the social stigma links to the fact that this is an illegal thing, but you've got some sort of loopholes in that you can get. Decriminalising removes a lot of that stigma. And so there is a strong move now, supported by the colleges, to decriminalise in the UK. Ireland. Ireland is an exception. You've probably heard stuff in the news about what's going on in Ireland. Again, it's the 1861 Offences Against the Person Act that says abortion is illegal. Now, this was written when Dickens was writing Great Expectations. That's the law that women live under in Ireland. In 1983, there was the Eighth Amendment. There's been lots of amendments proposed, and some have come to be on this. The Eighth Amendment in Ireland gives legal recognition of equal right to life for the fetus as for the woman. So as a result of that, abortion is heavily restricted in Ireland. In fact, in 2015, there were only 26 abortions in the whole of Ireland. So abortion is available if the woman's life is in serious danger. An estimated 5,000 women a year travel from Ireland to the rest of the UK for abortions, probably even higher, giving false addresses in the UK. It's come to the point that taking the boat to England is a euphemism for having an abortion in Ireland. So again, women still access abortions, women need abortions, they do not want to be pregnant at a certain time, do not want to parent at that time, and they access them, but there are different ways around it. So fortunately for women in Ireland, relatively fortunately, they can access safe legal abortions in the UK, but it costs them. They've got to travel, they've got to take time off, go overseas for it, or they get online abortion pills through online consultations, and there are some very reputable services that can offer that to countries with restricted access. But there are draconian penalties. If you perform an abortion illegally in Ireland, you could go to prison for 14 years. So nobody really wants to do that. And so you get a chilling effect around that restricted law. And I think we should just mention Savita Halapnavar. Oh, sorry. There we go. That's the UK there. October 5 years ago now, 2012. Savita, 31-year-old, married woman. She and her husband had emigrated from India to Ireland. She was a dentist. She was in her first wanted pregnancy. She was 16, 17 weeks pregnant, went into hospital with back pain, University Hospital in Galway, and then had premature rupture of membranes. The obstetricians talked with her and her husband and said that they, very sadly, that unfortunately this was going to, she was going to inevitably miscarry. This was a pregnancy that was not going to continue. She and her husband were very distraught. The next day on the round, they spoke to the obstetrician and said, well, if it's not a pregnancy that can continue, please can you end the pregnancy? Can you terminate this pregnancy, please? And the obstetrician said, no, there's still a fetal heartbeat. And we said, well, you know, it's inevitable. You've told me this baby's not going to survive. And said, no, we can't perform an abortion while there's a fetal heartbeat. The law says that the fetus has a right to life and we can't kill it. So despite that, their continuing requests, that their request for termination was denied. Savita went on, eventually the fetal heartbeat did die, you know, did stop. Savita went on to give birth to a stillborn baby girl, and within a week succumbed to septicemia from a septic abortion. At the inquest, it was said that there was no doubt that if she had had the abortion at the time she requested, she would still be alive today. So Savita is one woman. This is not an isolated example, sadly, but is one woman who died in a university teaching hospital in a developed country because of restricted access to safe legal abortion. And it shouldn't happen. The inquest declared a medical misadventure, but this has led to a grassroots campaigns to legalise or liberalise the abortion laws in Ireland. And thousands of people have taken to the streets. There's a big repeal of the 8th, because if there wasn't the 8th Amendment, she could have had her abortion. But as long as there was a fetal heartbeat, her surgeons didn't want to operate, and they didn't want to go to prison for 14 years if they'd been seen to perform an illegal abortion. This has led, these protests, to October last year. The government decided that they didn't want to have to handle this. It's too much of a hot potato. So they decided to set up a citizens' assembly. 99 randomly chosen individuals in Ireland from all walks of life, occupations, different areas, men, women, and one Justice, Chief Justice woman, Laffoy. And they sat down and there were over 8,000 submissions from both sides of the debate about abortion, whether to liberalise, whether to restrict, what to do, where. And they sat down and went through and listened to all these submissions. They came again together in April this year for 3 days, discussed it all, thrashed out a whole lot of scenarios. What would you do if this, this, and this? At the end, recommendations came out. And they were far, far, far more liberal than anybody has anticipated. 87% were in favour of very, very wide-ranging liberalisation of the law in Ireland. A consistent about 9 out of the 99 voted against everything because that was their personal belief system. But the rest all voted, 87% voted in favour. And so these recommendations have come. The government's still sidestepping it and have said we'll have a public referendum next year. So inevitably, I think we'll see a liberalisation of the law, but probably not to the extent that the Citizens' Assembly wanted. So just thinking about Europe again, we've talked about Ireland, the UK, we talked about generally in Europe, and following on from Savita really. Italy, sorry, you don't see much of it on this picture, but Italy, green, abortion is available on request up to 90 days from LMP. Sounds great. However, access, as Mike said about America, access, the law doesn't always tell you about access. Over 70% of physicians and gynecologists, obstetricians in Italy conscientiously object to performing abortions or being involved in abortion care. And in the island of Sicily, 87.6% of people conscientiously object. And this has led to a very, very similar, just October last year, a very similar case to Savita, where a 34-year-old woman in an IVF twin pregnancy went into premature labour, They would not refer her or perform an abortion, even though inevitably she was going to miscarry. And she died within 12 hours of delivering stillborn twins from septicemia, from lack of access to safe care. So they wouldn't even refer it, even though it's legal in Italy, refer it to someone else. So I say, unfortunately, not isolated examples. Exceptions are interesting. Poland used to be very liberal access to abortion when it was part of the Soviet Union, behind the Eastern, the Iron Curtain in the Eastern Bloc. However, end of the Soviet Union, rising influence of the Catholic Church, Poland now has very restricted law, only available if the woman's life is in danger. Rape or incest, if there's a criminal case or serious fetal anomalies. As a result, there's about 750 abortions a year in Poland. This is a population of 38 million. It's estimated that 240,000 women a year access unsafe abortions within Poland, or travel out of Poland if they can afford it, preferably going to Lithuania, Ukraine, Romania, because it's cheaper than going west to Germany, or accessing pills online. So women do still have the abortions, it's just that it makes it more difficult. Women of means can always access them somewhere. Women without the money often have clandestine, unsafe abortions. And this is a woman on web drone taking pills. And it really demonstrates the ludicrous nature of Germany, Poland, a couple hundred meters apart, being able to legally take pills from Germany up in the air, take them to Polish women who are able to access safe medical abortion, but illegally. And not content with the strict laws already, there was a push from the Catholic Church to make the laws even stricter, which led to mass protests and counter claims to try and liberalise the laws. And this has been going on since there. So Poland is in a state of flux. So, and what you see is internationally, the laws do change. You know, we've seen it change in Uruguay. Things move more liberal, things move more restricted. And as long as it's part of the criminal code, it'll always be vulnerable to shifts in political lobbying and campaigns. Just quickly shifting and just briefly talk about North Africa, Middle East. Whole different set of colours, eh? So red, orange, but highly restricted. Available in certain circumstances, but highly restricted. But again, it's quite interesting looking at who are the, and where are the exceptions. Tunisia. Abortion's been legal in Tunisia since 1973. It's just become legal, well, reduced restrictions in Morocco. The king there agreed that it should be available for women whose lives are in danger, fetal anomaly, rape and incest. So it does change. Iran, a big pulling back in Iran, had very good contraceptive policies. Since 2015, though, a need to increase the population. So they've actually made vasectomies and tubal ligations impossible to have. Midwives can no longer put in IUCDs postpartum, and very restricted access to the contraceptive pill because they want to actually boost the population. Sort of thing we saw in Ceausescu's Romania in the past and Hitler's Germany, restricting access to abortion to increase the cannon fodder. That's the basic way of it. Bahrain actually has fully available liberal abortion laws, out of interest. And again, women of means will fly to London. If you're pregnant and you're in Saudi Arabia, then your chances are you're going to go shopping for the weekend in London if you can afford it. So women of means will always travel or access safe abortion somewhere. But even in somewhere like Tunisia, although it's legally available, discriminatory practices affect access, particularly for single or unmarried or young women. Sorry, I need to go back one. Yeah. Sub-Saharan Africa, this is, again, predominantly restricted access with some very notable exceptions, South Africa, Malawi, and actually Cape Verde Islands, which is somewhere off in the Atlantic. But very restricted laws here. Yeah, really high rates. Uganda has a rate of abortion of 54 per thousand women. That's, you know, double the global average. Overall for Africa, 34 per thousand, and these are virtually all unsafe abortions. The maternal mortality in Africa is 546 women per 100,000. Compare that for New Zealand, 11 per 100,000. 61% of those maternal deaths are estimated to be due to unsafe abortion. So not only do we have high abortion rates because of the unmet need for contraception, the lack of sex education, these are also huge numbers because the population basis is really large too. And we've got that increasing young reproductive group coming through. So it is a huge issue for African countries. And Mike said it's a financial issue. It costs a lot more to cope with the effects of mopping up the complications of unsafe abortion than it does to provide a safe abortion service. And again, women of means will travel, but women who are poor will then face unsafe consequences. Maybe, you know, drinking kerosene, drinking bleach, putting sticks through the cervix to try and disrupt the pregnancy, as well as various pills and potions. But looking at the good side of things, South Africa, the good side is through the Maputo Protocol, a lot of the countries in Africa have signed up to improving maternal health care, and part of that is looking at pushing for safe abortion services. So there is a move from Sierra Leone right the way through to Malawi to look at liberalising laws. South Africa is interesting. Abortion was liberalised, was actually the first country in the world to decriminalise abortion in 1996. End of apartheid. Didn't want a bar of all the old colonial laws, instead new laws for new South Africa. And one of the things they looked at in sexual and reproductive health was what would make sense. And they came up with an incredibly liberal, reforming agenda through there, in a whole range of issues to do with sexual health, but decriminalised abortion up to 12 weeks and various grounds thereafter. And it's publicly funded. It's called the Choice of Termination of Pregnancy Act. However, access is poor. You need the infrastructure to match it. Only 7% of providers provide abortion services. 30% of South African women don't even know it's legal. 50% of abortions in South Africa are illegal. And yet there's widespread advertising of illegal abortion clinics. And to some extent, people say, well, how do you know where to go? There's so much advertising. Who's okay and who isn't? I don't think I'd go to Dr. Monica. To some extent, the more you pay, the more safe it's likely to be. But an activist group has just put out an app for smartphones in South Africa called FEM, and you pop it on your phone, and so with the GPS coordinates, it'll tell you where your nearest safe legal abortion clinic is, and you can actually go in and make an appointment. So hopefully that may improve things there. So just passing over to Mike for Asia. Oops.
In the interest of time, I'm just going to point out a couple of notable slides because I think you want to hear about Australia and New Zealand, and that's Janice's part at the end. So just want to talk just very briefly about China. China allowed sex selection abortion and had a one-child policy for many, many years. And they now have a significant gender mismatch in their population, where they have so many excess males from gender selection, sex selection, abortion, that it's affecting the reproductive ability of their population to be able to replace their population, because there are men who can't find women partners because their female children had been selectively aborted in the one-child policy. It's quite tragic. It's an interesting book to read, by the way, One Child. And in Japan, the workplace pressures and workforce pressures on women in the workplace are such that women are significantly pressured in the workplace to have an abortion, to not have a pregnancy, or they lose their career mobility. So the societal pressures about child rearing and reproductive health can go both ways as far as restricting the rights of women. And I just wanted to make note of, in the Philippines, abortion is illegal, and a method called abdominal massage is used for abortion in the Philippines. And it's hardly a massage. What it is, it's abdominal trauma is induced to a woman in order to have an illegal abortion. So this is what happens when abortion services are strictly, are very much restricted and not available. So I'd get Janet back up here to talk about New Zealand and Australia.
Yes. So, Australia, our bigger and greener neighbour. And I think what you can see there is that the abortion laws actually vary. Well, you can't see on this, but the abortion laws vary state to state. It's a federal system, so each state is different. But New Zealand is considered quite restrictive access. I think we have widely recognised that we've got a restrictive law, but is liberally interpreted. And I'll come back to that in a moment. Looking at Australia, though, Australia decriminalised abortion in Victoria about 4 or 5 years ago, and since then, Northern Territory earlier this year, Western Australia, Tasmania, and Australian Capital Territory, or Canberra, have all decriminalised abortion. So beyond Canada and South Africa, and more recently Mozambique, those states are the only areas that have decriminalised abortion completely. But in Western Australia, you still need parental approval for minors, and the actual finities of the availability are different. New South Wales has just voted to not decriminalise abortion, and the same with Queensland. And Australia runs into problems because of just the huge size of it. I mean, you can imagine if you're in a very small settlement way out in the wops in Australia, your access to abortion services are is very difficult. I mean, you may have a supportive provider in your local town, but you may have to travel huge distances. So a benefactor, actually, and he's a gynaecologist from Tasmania and he's a bit of an entrepreneur, he set up a service called the Tablet Foundation to provide telephone consultations throughout the whole of Australia for women to access early medical abortion and then get sent the pills online, have support, get posted the pills and have support through telephone services. He called it the Tablet Foundation. I thought it was Mr. Tablet, but it's not Mr. Tablet. He named it after Tony Abbott because Tony Abbott really doesn't like it, so he called it the Tablet. So, because Tony Abbott was so outraged, it became the Tablet Foundation. New Zealand law, for those who are not aware of it, abortion is illegal in New Zealand unless certain grounds are met. So the 1976 Contraception and Sterilisation Act said that abortion is illegal in New Zealand unless 2 doctors, term certifying consultants, agree that a woman has grounds for an abortion, and they could be on the basis of her harm to her mental health, her physical health. If it's a case of incest, if there's serious fetal abnormality, interestingly, rape is not a ground for abortion in New Zealand, nor are extremes of maternal age, but are factors that can be taken into account. Another part of the New Zealand law is that abortion is available if the woman is severely subnormal. It's very nice wording, it was 1976. And that's up to 20 weeks. Beyond 20 weeks, becomes more restricted, so abortion is available if the woman's life is in danger or serious risk of permanent harm to her mental or physical health. So that's the New Zealand law. But as we've said, generally speaking, this has been liberally interpreted, and the Abortion Supervisory Commission are aware of that and support that interpretation. However, there are still huge access issues. If you live in Hearth, getting access to abortion services, you've actually got to go to Christchurch. So, there are still significant areas of inequity in access, and different centres allow make different levels of abortion care available. Invercargill recently, very brave group, team have set up an abortion service there. They have had threats against their life when they were setting this up. They had threats that they were going to be shot, killed, and this is what 3-4 years ago in Southland. So the so-called pro-life group are not always quite so pro-life. But they have set up a service and they provide a very good abortion service up to 12 weeks gestation. Pacific Islands, really most Pacific Island countries, abortion is not available, has very, very limited access. Some access in places like Fiji, Vanuatu, but very limited access. And interestingly, I was doing a sort of teleconference with a whole lot of on abortion module, part of the DIPOBS, and there were people from 3 doctors from Samoa on the panel. And so I said to them, so what happens in Samoa? And interestingly, what the doctor said, and I thought it was fantastic learning for the other students, is what I've read about. Okay, I've not worked, I've not had to experience the really traumatic effects of unsafe abortion, sort of things I'd read about. But she immediately just said, well, either they will go to a local healer and they'll get herbs and potions. They'll either drink or put in the vagina, or they'll take cassava sticks and have those inserted through the cervix, or they'll conceal the pregnancy and basically will induce unsafe abortion primarily. The concern, of course, about concealing pregnancies, and we've had it happen to a student, a Pacifica student in Dunedin a few years ago, is you continue the pregnancy, you're concealing it, and then you actually deliver an attempted infanticide. And so when things are really stressful for people, they do the best they can, but often it's sad, it's unsafe. Of course, women with money will travel. They'll come down to the Auckland Clinic, AMAC Clinic, which is a non-profit private clinic in Auckland, and have their abortion there. And again, abdominal massage is used to try and abort the placenta. And more women who know about these things may go online and access medical abortion pills in early pregnancy. So our neck of the world, we have good access within New Zealand and Australia, but very limited access in the rest of the Pacific. So in memory of Savita and the many, many women who have suffered and died as a result of these laws, I would just like to say in conclusion a few things. Clearly, abortion laws vary from country to country, within countries, and they vary in their interpretation. And who knows what's involved in them? A lot of medical people don't know what their laws are. Generally, it's, across the world, it says it's illegal unless certain circumstances. But and these restrictions are not based on any medical evidence. They're totally arbitrary. Yet abortion, as Mike has said, is one of the safest procedures, one of the most common procedures in the world, and one of the safest procedures. Yet it's heavily, heavily regulated and legislated. Restricting access doesn't happen in a vacuum. It's part of a whole social context. So the places we said restrict access to contraception, to sex education. And inevitably we have unintended pregnancies and increased abortion rates. And since most restrictions affect poor women in poor countries, it is they who have the greatest burden of these restrictions. With 44,000 women estimated to die every year, that's 5 women in the hour we've been talking have died. That's every hour of every day, of every week, of every month. We are suitably horrified by what's happened in Las Vegas recently. We're horrified when disasters strike, earthquakes, flooding, and yet this is happening to 44,000 women every year, ongoing. As Dr. Polanick, former head of FIGO, once said, women are not dying because of diseases we cannot treat, but because society has yet to decide their lives are worth saving. Reducing legal restrictions doesn't always mean good access. We've seen that. You need the infrastructure to support it. We need conscientious commitment for providers to treat and look after these women and provide these services. If we want a society that allows women to participate as equal members, women must have control of their reproductive health, of their fertility, be able to make their own choices about reproduction. And as a just society, we must respect women's right to these choices. And just to acknowledge the people who've been murdered, abortion providers murdered by pro-life activists, the latest George Tiller in 2009. I'd also like to conclude, we entrust women with the prime responsibility of parenting children, of nurturing children, of the prime work of child rearing, why do we not then trust them to decide when it is right for them to be pregnant and to parent? In a statement just last Thursday was International Safe Abortion Day, 28th of September, the United Nations human rights experts urged, quote, all states to end the criminalisation of abortion and to ensure that women are able to access all necessary health services, including sexual and reproductive health care, in a manner that is safe, affordable and consistent with their human rights. And as the late George Tiller said, I trust women. So thank you to Department of Women and Children's Health and the Southern DHB, who also helped. Mike and I presented this at the ACOG conference in San Diego earlier in the year.
Maybe a quick comment or question. I really do want to throw this. I do. You want it, Helen?
So I just want to ask a question, which is with regards the Health Practitioner Assurance Act 2003, which states that, and this is around conscientious objection, although it's not really the term that's used within it, but basically states that medical practitioners can decline to provide care with regards to contraception and other reproductive health services. So I was asked the other day, would in New Zealand Savita's case happen? And I said, well, if you were somewhere like the West Coast, where there was no abortion providers, and perhaps someone actually had a conscientious objection to abortion, I don't see why it couldn't. And it would be legal for someone to not provide an abortion in that situation, as I understand it by the law. So that's my question is, do you understand that you could legally allow someone to die in New Zealand by choosing not to provide an abortion?
I agree with you. That very much can happen in New Zealand. With the access, there are facilities that don't have certifying consultants, and that's a legal requirement for a woman to have a termination of pregnancy, even if she has a septic abortion. If she's critically ill, 2 certifying consultants must sign on that document, and those certifying consultants can sign on the no line. That absolutely can happen in New Zealand, and there's been a push for law reform in New Zealand to take abortion out of the criminal code and put it under the Ministry of Health rather than the Ministry of Justice. So abortion care in New Zealand is under the auspices of the Ministry of Justice and not the Ministry of Health.
I think as an added thing to that, we have the wife of the current Prime Minister to thank for the fact that that would be possible, because prior to that time, and possibly John might speak on this, it was generally part of the Medical Council guidelines that you could choose not to be involved in the provision of an abortion. You couldn't, clerical staff and nursing staff can't decline to be involved before, after, or if there's an emergency, you can't decline care, but you could decline to be directly involved. But should you decline, you had then to refer on. And it was Mary English and a group who took it to and said that infringed on their liberties. And I think I was very sad to see the Medical Council actually back down on that and allow that to go through. So I think since then it has been an issue. Before that ruling, I think you would have had to refer on.
I think we need to wrap up. The next group is waiting to get into the room. So, thank you very much for your attention.